Hey guys, it's Mayflow. Welcome back to my channel, or if you're new, welcome to my channel. As you can see, if you haven't noticed actually, I changed my YouTube name, and I kind of did it because going forward, I talked about my plans for my channel and how I wanted it to go, so I think the new name of Bay the PA kind of rhymes, and Bay the PAS actually for now, because technically I'm a student, well, will be, and so we're just going to go forward from there and see how it goes. But if you haven't already, please hit that subscribe button, come join the gang, help me out, and pretty soon I'll be doing a giveaway. I think I'll try to do it when I hit 500 subscribers. Right now I'm over 250, so I'm halfway there, and I'm excited, so we'll see how long it takes for me to get there. But anyways, for this video, I kind of wanted to talk about, I know a lot of people have questions about what type of patient care experience they should do for their pre-PA application and what is best. And a lot of people recommend the traditional direct patient care hours where you're like a nursing tech or something like that, where you're hands-on with the patient, and I think that's great. But as far as from my experience, I'd say the best clinical experience you can have before going to PA school, I would say, is a medical scribe. And there's a few different reasons, probably 3 different reasons I'll talk about today or so, we'll see. But ultimately, it's like I can't explain the amount I've learned just being a medical scribe and how that's going to impact me when I go to PA school. So I put a list on my phone of a few things that I think is important of why being a medical scribe is so important before going to PA school. So number 1 would be the exposure. Obviously, depending on where you are a scribe, but from my experience, I'm talking about from the emergency department, the exposure you get there. And there's so many different things you see, it's unbelievable. So anywhere from chest tube insertions, intubation procedures, central line placements, conscious sedation procedures like for reductions and stuff like that, laceration repairs, incision and drainage procedures, literally all those types of things you can, the person you're working with will always allow you the opportunity to sit in on those procedures. So, all those procedures I named, I've seen every single one of them, and it's really it's amazing to see, those types of procedures even before you're starting school. And I think that's probably the number 1 reason why I think medical scribing is, a top-notch patient care experience option for those of you who are looking for some. Another reason, the second reason, would have to be the terminology. Going into medical scribing, I felt like I had a pretty good medical terminology background, which I did, more than the average person, but, being exposed to these things every day, there's so many things I learned, and it just widened my terminology, medical terminology, to I would have never imagined, and just being aware of diagnoses that I, never even knew about, and it's just amazing to be exposed to those things now, and then not, when you get into PA school, it not be completely foreign to you, and I think that's super important as well. And then another one that I think is super important, so not only the flow that you learn as a medical scribe in the emergency department, but the synchronization you obtain with the provider you're working with. So the more you work with certain providers, the more you know how they like to chart things and what they like to do, and it also gives you pointers to look out for when you're working with different providers that you might have not worked with before. And it's just an amazing learning experience, and being able to work alongside them and see the way they treat different procedures and treating with medications and stuff. You get used to seeing certain medications ordered for certain things, for example, you see an open fracture or something, and literally every time an open fracture happens, the antibiotic Ancef is ordered, and usually they're transported to surgery or whatever it may be, but you get used to the flow of things, and you start recognizing medications for certain ailments or certain medical conditions, and I think it's a great head start before you get into PA school, because a lot of times when you're either like a tech or doing something else, you're not really exposed to these types of things, and you're just really doing like the work that, you know, I don't know. I don't want to make it sound bad to be a tech, because I think that's a great experience as well, and you get hands-on experience, but you're not so much involved in right next to the provider and, you know, knowing what they're ordering for certain things and stuff like that. Literally, as medical scribe, you're pulling these things into the chart as they're doing it, you know, and it's live documentation. There's no other experience like it, and I just think it's so important that to be exposed to these types of things. And another thing that, you know, is kind of hard to talk about, but you also, like, you get to see the good and bad, you know. You get to see people's lives being saved, but you also get to see people passing away. And you know, that's super sad, and obviously it pulls on your heartstrings, and especially when they're patients that are super young and, you know, had a full life ahead of them, it gets you really sad. But at the same time, to be exposed to those type of things before you get into the profession or before you become a student is just, you know, I feel like it gives you a head start in a way. I think medical scribing is such a good opportunity, and I think it's becoming more accepted with PA schools and for patient care experience. So if I were to recommend anything for patient care experience, it would be medical scribing. So yeah, that's pretty much it for this video. So don't forget to like, comment, share, and subscribe. Come join the gang over here. Let me know what you guys think, and if there's any type of videos you guys want to see regarding the PA profession. I hope you guys enjoyed this video, and I'll see you guys in my next video. Bye.